To what extent, I know several people have talked about uh, trying to identify the people who are, in this context anyway, kind of the high flyers, the people who are the frequent utilizers, the people with chronic conditions, and getting their participation up. Is that something that would make it a whole lot easier to identify savings or to identify health improvements and productivity improvements the way David was talking about? And is it permissible under these regs or the old ones to be more selective in who participates in these programs?
Well, I don't know if it's permissible, but it's probably, the cat's already out of the barn on that one, because, if you look at the usual sort of pyramid of morbidity, you have 20% of your people or less who are 85% of your costs, and those are people who have chronic diseases and are on a lot of medications already. Wellness will have no impact on that population. So it doesn't really make any sense to be sort of targeting your more chronically ill patients. From a workplace point of view, those are the people that doctors and nurses have to be worried about and how they're going to be taken care of. I'd say the wellness is much more, sort of trying to prevent people from moving into that part of the overall morbidity curve, and you're much better off sort of dealing with people who have basically sort of latent illnesses, because most people, if they don't get their biometrics done, then they don't know whether or not they're carrying potential problems into the future.
I think that the wellness programs will work to catch more of these people who have these risk factors, but I feel like I'm just gloom and doom today. One of the things that I think is a bit troubling is the kinds of recommendations that we've been talking about are sort of one-size-fits-all medicine. So if Troy's right, and what happens is you catch a health risk factor, you go to your doctor, you get your doctor's advice, that's terrific. But if we're talking about kind of truths that everyone knows that turn out to be actually sort of controversial and not uniformly held and not uniformly appropriate, then I start to wonder, so what happens to somebody with the high blood sugar level, and then there's a recommendation for glucose lowering, except for there are all these studies that have come out recently that suggest that, well, glucose lowering medication can in fact lower blood sugar. It's been associated with higher mortality rates. And so these are the kinds of, or